New substances that activate adrenaline receptors instead of opioid receptors have a similar pain-relieving effect to opiates, but without the negative aspects such as respiratory depression and addiction. This is the result of research carried out by an international team of researchers led by the Chair of Pharmaceutical Chemistry at Friedrich-Alexander-Universität Erlangen-Nürnberg, FAU. Their findings, which have now been published in the scientific journal Science, are a milestone in the development of non-opioid pain relief. Opiates cause addiction. New substances do not. They are a blessing for patients suffering from severe pain, but they also have serious side effects. Opioids, and above all morphine, can cause nausea, dizziness and constipation, and can also often cause slowed breathing that can even result in respiratory. In addition, opiates are addictive. A high percentage of the drug problem in the USA is caused by pain medication, for example. In order to tackle the unwanted medical and social effects of opioids, researchers all over the world are searching for alternative analgesics. Professor Dr. Peter Miner, Chair of Pharmaceutical Chemistry, is one of these researchers. We are focusing particularly on the molecular structures of the receptors that dock onto the pharmaceutical substances, says Miner. It is only when we understand these on the atomic level that we can develop effective and safe active substances. Collaborating with an international team of researchers, Professor Miner discovered an active substance in 2016 that bonds to known opioid receptors and that offers the same level of PA. New approach. Adrenaline receptors instead of opioid receptors. Peter Miner is currently following a lead that seems very promising. Many non-opioid receptors are involved in pain processing, but only a small number of these alternatives have as yet been validated for use in therapies, he explained. Miner and a team of researchers from Erlangen, China, Canada and the USA have now turned their attention to a new receptor that is responsible for binding adrenaline, the alpha-2A adrenergic receptor. There are already some analgesics that target this receptor such as brimonidine, clonidine and dexmedetomidine. Miner. Dexmedetomidine relieves pain, but has a strong sedative effect, which means its use is restricted to intensive care in hospital settings and is not suitable for broader patient groups. The aim of the research consortium is to find a chemical compound that activates the receptor in the C. In a virtual library of more than 300 million different and easily accessible molecules, the researchers looked for compounds that physically match the receptor but are not chemically related to known medication. After a series of complex virtual docking simulations, around 50 molecules were selected for synthesis and testing, and 2 of these fulfilled the desired criteria. They had good bonding characteristics, activated only certain protein subtypes and thus a very selective set of cellular signal pathways, whereas dexmedetomidine responds to a significantly wider range of proteins. Pain relief without sedation in animal models. By further optimizing the identified molecules, for which extremely high-resolution cryo-electron microscopic imaging was used, the researchers were able to synthesize agonists that produced high concentrations in the brain and reduced the sensation of P. Various tests confirmed that docking on the receptor was responsible for the analgesic effect, explains Miner. We are particularly pleased about the fact that none of the new compounds caused sedation, even at considerably higher doses than those that would be required for pain relief. The successful separation of analgesic properties and sedation is a milestone in the development of non-opioid pain medic. However, Professor Miner has to dampen any hopes of rapid widespread use in human medicine. We are currently still talking about basic research. The development of medication is subject to strict controls, and in addition to significant amounts of funding, it takes a long time. However, these results still make us very optimistic. Make a difference. Sponsored Opportunity StorySource. Materials provided by Friedrich-Alexander-Universität Erlangen-Nürnberg. Note: content may be edited for style and length. Journal reference: Alyssa A. Fink, Jun Shu, Harold Hubner, João M. Braz, Philip Seaman, Charlotte Avett, Veronica Craik, Dorothy Weichert, Maximilian F. Schmidt, Chase M. Webb, Natalia A. Tolmakova, Yuri S. Moroz, Shi Ping Huang, Chakrapani Kalyanaraman, Stefan Gabauer, Zheng Chen, Zheng Liu, Matt. Structure-based discovery of non-opioid analgesics acting through the alpha-2A adrenergic receptor. Science, 2022, 377, 6614, doi, 10. 1126, Science. ABN 7065. Cite this page, Friedrich-Alexander-Universität Erlangen-Nürnberg. Pain relief without side effects and addiction, better than opiates. Researchers use adrenaline receptors for highly effective analgesics. Science Daily. Science Daily, the 19th of October 2022. ift.tt/vseti. Friedrich-Alexander-Universität Erlangen-Nürnberg. 2022, October 19th. Pain relief without side effects and addiction, better than opiates. Researchers use adrenaline receptors for highly effective analgesics. Science Daily. Retrieved October 19, 2022 from ift.tt/vseti. Friedrich-Alexander-Universität Erlangen-Nürnberg. Pain relief without side effects and addiction, better than opiates. Researchers use adrenaline receptors for highly effective analgesics. Science Daily. https://ift.tt, vszeddi, accessed October 19, 2022. Thanks for watching. Please subscribe my channel for more videos.